Will BDS be a good option for you? Will BDS be a good career to opt for, especially in India? And most importantly, is BDS for you? Is being a dentist for you? Hey guys, welcome back to your channel Dr. Battisi, and I'm your dentist Dr. Jasmine. Before we begin with Is BDS for you, I want to share that there is a website called nirfindia.org, nirfindia.org. It is an official Indian government website for the listing of all the colleges in India, the best and the top ones. So if you're looking for a college for you, you can go through this list of the 2021 of or 2020. And if you have to look for the references, that is the college you are opting for or you got through the counseling, is it for you, is it the right college for you? Look for the students there, visit the college. Also look for the people studying there on Facebook, on Instagram, on LinkedIn. There are many places where you can search for. Just type the college you are into or just type the course you are into and see how many people are there. Contact them through online, contact them, just ask them how the college is, what are the things you should know before entering into that college. Guys, BDS is a 5-year course. Of course, I'm not here to tell you what the course exactly is. I'm here to tell you, is it for you? How to choose that, is BDS for you? So BDS is a 5-year course which is 4 years exam, first year, second year, third year, final year, and the internship, which has no exam, but it's like some colleges do pay you stipend. Government colleges, the stipend is more, approx 10 to 12,000. In private colleges is 2 to 3,000. My college stipend was 2250. It was, we used to calculate it, and it was like 75 rupees per day. But it varies. Also, the most important thing you have to see here that if you have already joined the BDS college and you want to change it over in the internship, you can do that. Also, do not choose BDS if you did not got an MBBS seat, or you do not have the right amount of money with you so that you can opt for MBBS, and you are confused about other options. So you think, okay, BDS, you will be a doctor and the fees is less, so I should opt for this. Do not do that. Choose BDS as a choice and not an option. Please. BDS is not a joke. It's already a specialized branch of dentistry. It's already, of the body. You're already into focused into teeth, oral cavity, head and neck. So please do not, it's not joke. So you are already will be a doctor of a specialized thing. According to the survey of the WHO, I think it was in 2016, the report was there that according to WHO, the ideal ratio of the number of dentists to the number of patients should be 1 is to 7,500. That is 1 is to 7,500. However, in India, it's 1 is to 5,000, meaning one dentist for 5,000 patients. It's already quite less than the ideal ratio, meaning there are more dentists than required. So in India, we do not need quantity of dentists, we need quality of dentists, which is really lacking. We need people, if they are coming from not so city oriented places, we need people, we need real dentists who have the degree to go into the deeper roots, to go into the deeper inside of the India, which is really lacking because many people are really saturated in the cities. We need rural dentist taking over and not just quacks. Choosing your career majorly is about two things: money, of course, which most of the society and people are focused on, and of course you need money at the end, you want to earn well. Second, which is for morely self satisfaction, which is interest. What are you really interested in? When you choose bio in 11th or 12th, or as I did, it was like I'm really too much interested in bio. In fact, even I still remember some of the, it's like a camera picture clicked in my brain on the of the NCRT biology book, because I'm really interested to study what exactly, it's not man-made but something which is actually there, which is we humans can't even imagine to create. So I really like to study that. So interest, and when interest is worked upon, it becomes passion. And when there is passion, people can see it. There are few things I would like to share that will give you the exact idea if dentistry is for you. There is a book called Dentistry Unlocked, first book in India on successful BDS. You should refer to it. Links are in the bio. It will be a hardly few hours read or maximum 1 day read, available in Kindle and paperback. There is a playlist on the channel Dr. Battisi called Successful BDS, also a playlist called Career Opportunities After BDS. These videos, Successful BDS playlist has about 25 to 30 videos. Please go through it, everything, like who is the first dentist of India, the story about it, what to do in the first, second, third, final year of BDS, and what happens and what you should do after and during your internship. My experiences in a clinic and being a JR at the government hospital. And these videos will give you all the idea you need to know before you enter BDS, because when you know what all happens and when you can see yourself at that place, then you would know if BDS is for you. The most important and interesting facts about being a dental student or a dentist is that we start to treat patients from the third year itself. That is called white coat ceremony happens, and it's like a celebration to entering the real clinical practice and not just preclinical, which happens in the first and second year itself. So and the second most important thing is beautiful things. It's not beautiful, but the most fascinating thing I would say is that dental pain is the second most painful thing in the world after child delivery. Also, as I said earlier, you are already a specialist. Of course, if you are really interested, you can go further to MDS and more into specification, but already you are a specialist. And we are not, guys, we are not just, like sitting and we have to prescribe medicine, but it's like real work. We can't just okay, deal with the patient just by sitting. Yes, we can give the antibiotics, but we have to see their oral cavity. We have to have a patient on the dental chair. We have to work actually to treat a patient. It's not just we can do something on a call or something. Of course, the pain, if there is an emergency, we have to tend it on a call, but we have to work on the patient, and that is a really beautiful thing. And in Dentistry Unlocked, guys, there is a thing which is on page number 39 of it, and it says, do you know the five qualities of a surgeon? No matter who the doctor is, even if it's an MBBS, but what is a surgeon? You need these qualities, and same goes with being a dentist. There are five qualities of it. The first is lady's finger, should be gentle in handling patients and tissues. You don't have to be traumatic, you have to be gentle. Lion's heart, being brave to take the decisions. This is the most important thing. I have been saying in many videos that you have to take decisions, you have to be independent, you have to think on the first go. Okay, since the very first day in BDS, like, okay, this is the patient, this is the chair, I have to treat the patient alone. What will happen if I'm alone in the clinic and the patient depends upon me? I am competent enough to handle. The third is eagle's eye, carefully watching changes occurring in the patient during treatment. We have to be very observative. Horse's leg, intense stamina to withstand long hours of surgery. This is really important, because if we do not learn the right way to sit on the dentist chair, which chair positioning we should opt for while treating which tooth, it's going to be really give you a backache, and it's going to be a really hard one for you, because we really get tired. Camel's belly, ability to carry on without food for hours. This will happen because when we get into preclinical and when we have quota or when we have some few patients to do, if a patient is sitting on chair, you can't just say, okay, please sit for 5 minutes, I'm going to have my lunch. That doesn't happen. Even if you, in our colleges, even if you used to get fever, we have to take the pill. If our patient is cold for that day, we have to take the pill, we have to take the medicine, and we have to go and treat the patient. That doesn't mean, okay, we can call the patient and say, aap kabhi baad mein aana. If you have called the patient, if there is an appointment, you have to be there, unless of course it's an extreme emergency or it's some condition which you cannot be there. So This all is about BDS, guys. BDS is about creation, having a creative mind, having good skills which are developed. ऐसा नहीं है कि if you do not have the skills you cannot be a dentist. It's about communication, it's about being quick, it's about being gentle, it's about being kindness, it's about gratitude, it's about being thankful to the patient, to your first patient, to your every patient, because of them you are learning, you're practicing upon them. It's about having good drawing skills, maybe it's about hard work, because you have to repeat a lot since the very first year of various tooth, of various carvings, soap carvings or wax carvings of different tooth. You have to form a tooth, and there are various channels available on YouTube, on Instagram, on Facebook. People are sharing their dental cases, amazing doctors are sharing their dental cases. See, if those things fascinate you, if this world of dentistry is really interesting to you, give dentistry 2 to 3 days at least of your life to see what exactly it is, and then choose it. If dentistry is for you, go ahead. When you are a dentist, you are a photographer, you are a manager, you are an entrepreneur, you are in businessman if you open your own clinic, you are everything. You are a dental assistant, you are the one who manages it, you are a dental receptionist, you are everybody, you are a whole package into one. So you have to learn all the skills. Most probably the business and everything is not taught in a dental school, but at the end I will also say that if you want to learn something, it's totally upon you also. So this channel, Dr. Battisi, is not about how to study something. Of course, I do have videos on how to study the basic subjects which people and the students find it difficult. But Dr. Battisi is all about how to, what happens exactly after your dental school, after your dental college, what exactly there is a real world of dentistry, because it's far vast. What happens in a real clinic, it's of course the trailer of what happens in the dental school, but it's not the puri film. It's the picture is quite different. Wish you all the very best and stay safe and healthy. This is Battisi signing off. Bye.